Well, we're working very closely with the governor's office. We are doing the best we can under the new laws to be able to encourage people to wear masks and to get vaccinated. There are conversations every day. We have a number of subcommittees for Public Health Advisory Committee. We speak to immunologists, our physicians, our caregivers, our nurses, our pharmacists to have situational awareness every day. So what we do know is that we have a robust program in place to be able to protect the students, staff, and faculty at the university. What we don't know is how much more this is going to transmit. And what we do know, the numbers are rising around the country. The variant that we have now is more transmissible. And we fear that we could start looking a lot like we did last year, where we're going to have to take measures to protect the public, the university, and so on.
Dr. Carmona, what is your recommendation to families with children who can't get the vaccine? This week, we learned that Arizona is one of the leading states when it comes to pediatric deaths associated with COVID-19.
Well, the best advice I can give right now, as soon as the vaccine is available for youngsters, and that's being studied right now, and hopefully sometime into the fall we'll have that information. I believe it will be found safe that you get the vaccine. In the interim, for those under 12 years old that are in school, they should wear a mask in class. What we do know are that children spread the disease pretty quickly. And even though most children don't do poorly, they get sick, it's like a bad cold, but there are some that get very, very sick, especially those who have pre-existing disease.
Can you give us some insight on why the FDA has not given the vaccines the full approval? Because it seems many people are watching and waiting to see that happen.
Yeah, well, first and foremost, the public should understand that the EUA, or Emergency Use Authorization, is a mechanism to get something to market much quicker, especially in an emergency when people need a drug or a vaccine in this case. And so it's done with limited information, but enough information to be able to make a decision that it appears safe. When you do the final, it's much more information, much more in-depth study to ensure that that original decision was correct. So I know they've accelerated that right now, and there's teams working on it full time, but there's a lot of information around the nation, and it takes a while to aggregate that information.
Let's say the emergency use authorization dissolves, the FDA approves it. Does that bring the buy-in from the public that you would like to see as a former Surgeon General?
We would hope so. There are some people that is what they're saying. Well, if once they fully approve it, I'll do it. I think that I would say to those people, get the vaccine now because you're going to protect yourself and protect your families. If you don't believe me, look at the news every day and look at the people who have not been vaccinated, who are otherwise young and healthy, are in ICUs and very, very ill. So it's very important that everybody gets vaccinated now. If not, we have a lot of the population that is going to continue to spread this infection. The longer the infection spreads, the more likely the variant changes or mutates, and it can get different characteristics then, including at some point maybe being resistant to the vaccine we have, which would be catastrophic.
Why the recommendation to wear a mask if you have the vaccine?
Even people who are vaccinated can carry the virus and therefore spread it inadvertently. So when you're in close quarters, when you're indoors, when you're with people that you don't know their vaccination status, it's probably a good idea, an added level of safety, to put that mask on.
And finally, for people who are still waiting on the vaccine because they want to see FDA approval, they're concerned about their privacy in the workplace when it comes to mandates, what do you say to them?
Well, the privacy is an issue, and I know in speaking with many employers, trying to walk that fine line to maintain privacy, but also to ensure that everybody is vaccinated. Your employer wants to know you're vaccinated because if you're coming to work, if you're in a service industry, if you are even a policeman or a fireman and you're engaging with the public every day, we want to know that you're not only doing your job safely, but that you're not inadvertently transmitting disease because you don't have a vaccine. And I know in the county, we are doing everything we can here to reach out to those disadvantaged populations on the Native American lands, the poor folks, the migrant workers that are working the fields. We have mobile vans going out to vaccinate them. It's that important that we're committing resources to make sure that everybody has the opportunity to be vaccinated.
All right, Dr. Carmona, thank you for your insight.
Thanks very much.